have got to move with Parkinson's disease. It is critical. Why? Those Oreos are kicking in faster than the chocolate chips ever cooked in. Yeah, why? Because Parkinson's slows you down, doesn't it? How many of you notice you're a little slower, my Parkinson people? Yeah, how many of you realize you're a little bit slower, my senior caregivers? You know, I am up here working on my perch, and I want you to raise your hand and get animated and wake up and respond to me, okay? This is Parkinson Power. This is empowerment. This is motivation. All right? Okay, so it slows you down. It's very, very, very easy to sit down, to lay down, and to stop. You notice that? Because of a couple different reasons. Number one, you're slower. Number two, it takes twice as much energy and calories and effort, all right, to do the things that the non-Parkinson person finds very easy. Doesn't it? Takes more effort, more focus, more energy, more concentration. The other thing too with Parkinson's disease is you lose your impulsivity. I'm going to jump up and run across the living room and dining room and get myself a nice tea. How many of you think that way? I'm going to jump out of bed and run to the bathroom. You're not jumping and running so much anymore, are you? Okay, so the key is to have a healthy amount of exercise and mobility in your daily life. How many of you are doing it? What are you doing? What are you doing for exercise? Walking is a wonderful way, isn't it? Isn't it? We had a beautiful Sunday. We have beautiful weather. Please remember where you walk. Please remember not to walk alone. And please remember that when you walk somewhere, you have to have the strength to walk back home again. Right? Remember that. So get up and walk. It's great for your long bones. It's great for your balance. All right? And stay mobile. What else are you doing?
Gain knowledge about your disease.
Yeah, the other great thing is knowledge. Knowledge is what? Power. Now, it's those three little words you hear it so many times, but knowledge is power. There is so much to know and to understand about Parkinson's disease because it affects every different and impacts every different level of your life. I'm a firm believer that if I'm going to have a relationship with a disease or with a human being or with anything else, I have to know it, right? You have to know it, you have to understand it. So that the more knowledge that you gain about your disease, the more power that you have over it. The better equipped you're going to be to live with it, to tolerate, to understand what is happening to you. It's very important that you understand why certain things are happening with you, right? It's just not, oh, I'm slow. Oh, I can't swallow. Oh, I have a tremor. Your power comes in knowing why. And what is the why? What is the answer to the why? Why do you have a tremor? What's the important? Yeah, you have to go back a little bit. Yeah, glorious answer. You have a tremor because you have Parkinson's disease. That's it. Okay. What you're lacking is in what? Dopamine. And dopamine does a very special thing. You know what it does? Dopamine allows you to have smooth, controlled, balanced movements. Right? Alright? When you lose the amount of dopamine necessary to have smooth, controlled movements like this, right? And like this, then we have to supplement you with cinnamon. Right? All right. So when that decreases, that starts with your pill rolling. It starts with your slow movements. What else have you got going on physically? Your postural instability. You know how you start to sway because this way and this way. Why? Because you lose the strength in your trunk. Right? Slow movement. Even when you pick up the fork, are you going like this? You eating like this anymore? No, you're not. You're eating like this maybe, and picking up the toothbrush a little slower. And then with your shuffled gait, right? There is a reason for everything with Parkinson's disease, and everything stems from the lack of dopamine, all right? And the fact that the disease affects all the muscles in the body. Doesn't that make sense?
Can they do a test to find out how much dopamine is in your body?
No, this is a rule-out disease, just like all the neurological disorders. You know, they do a rule it out. So a big thing with your diagnosis with Parkinson's disease is your clinical assessment from a board-certified neurologist. Anybody here not being under the care of a board-certified neurologist needs to make that change this afternoon. Because Parkinson's disease, you need the overseeing, you need to have that brilliant physician at arm's length when you need them. Because Parkinson patients can change very quickly, right? And this is you are high maintenance. There's a lot to look at with this disease. So your neurologist, after your caregiver, is one of your very best friends. So pick that physician wisely. I will tell you that I've noticed for some of my friends that are here with us for, we call you the snowbirds. What does that mean? That means you leave the snow and become a bird. You fly on down here. Dumb, isn't it? Boy, they're getting the weather up north, aren't they? And here we sit. I wore flip-flops on Sunday watching the snow up north, and I was like, ha, 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 you know. But I'm encouraging, as a helpful protocol for you, that if you're going to be in Sarasota for more than 30 days, 60 days time, that you run through the USF clinic here at Parkinson Place and be assessed by Dr. Juan Sanchez Ramos. At least you'll have a local neurologist if you need a prescription for something or if you need urgent care for something. Doesn't that make sense to you? Because I'm having so many, Florida will not accept out-of-state scripts. And if you are down here and we have to get you into the healthcare system, or if we have to get you a referral, or if we have to get you into big or something like that, Dr. Juan Sanchez Ramos can write that for you once he has seen you. So that is something that I'm going to encourage my people to. He sees patients and he'll see you for 1 hour every Wednesday afternoon. It'll give you that safety net. Those of you that live here 12 months a year and have your neurologist, you're all set. Okay? So really think about that. But be wise. Be careful though what you read. A lot of times you can go online and read stuff that's going to scare you. Simple. Always realize that there are no two Parkinson patients the same. So you might have one, some, or none of the symptoms. And every human being responds differently to the treatment plan. Did you know that? So you may not compare yourself to your neighbor or who's sitting next to you at the dinner table here today. Because you are unique with how your disease is going to progress. You are going to be unique regarding to how you respond to your medications and your treatment plan. So only focus on yourself and how am I doing today, and am I doing my best. Don't ever compare yourself to somebody else. Don't ever say, well, I've had it 10 years, he's had it 20, I'm going to look like that in 20 years. That is silliness. Do not do it. Got that? Yes, ma'am. Oh. I don't even get that from the staff. I'm getting a yes ma'am from my friends. Wow. Okay. Now today's conversation is I think it's speech and swallowing problems. And this is a huge topic. This is a huge topic. How many of you with Parkinson's disease have noticed that your speech is getting a little more difficult to understand? It's getting a little bit softer. Huh? How many of you have noticed that? Have noticed that? Some of you husbands and wives are grateful for that, aren't you? I'm sick of listening to you, honey. No, it's very, very important that you maintain the volume and the articulation of your speech. Why?
So people can understand you.
Yeah, Rita, so people can understand you, so you can talk to me. You can communicate to me your needs, your concerns, your feelings. What is more important in a relationship than communication? Dignified, gracious, kind conversation, not the other stuff, okay? That I don't like in your life. But your ability to articulate and have the volume when you speak is critical. Why? What are some of the things that you need to be talking about? How many of you find yourself speaking and communicating less since you have I got a caregiver back there raising her hand. That's a whole other dynamic. Since you've had Parkinson's disease. And why is that? Richard, why?
I don't know.
He doesn't know. Now, the other thing I always try to remind you is, if your husband or wife is never a big talker, a big communicator, real verbal, yakety, yakety, yak, before they were diagnosed with Parkinson's disease and were affected by some of the problems with speech, they're not going to start now being chatty Cathy. Do you realize that? So if you have someone that was very quiet, very shy, very private with their feelings, they're not going to open up to you now because Marilyn says, open up your mouth and talk about your feelings. Okay? So realize what that human being was going into it. But you want to do your best to communicate. Did I say talk? What did I say? All right. What's the difference between talking and communicating? Communicating is a lot broader. And I am not a speech pathologist, but I feel like communicating is my ability to get what I know or what I feel from inside of me appropriately, effectively, successfully into you. And that isn't easy sometimes, is it? Talk is just, oh, it's raining, or the refrigerator just quit, or somebody ran over the cat, all right? As opposed to, I am really feeling tired and frustrated today. I need to sit down and talk to you about my feelings. You see the difference? Communication is not easy. Why is it not easy?
Sometimes we don't even know our own feelings, and trying to sort those out and communicate to one another. It's
Usually Rita says sometimes you don't even know your own feelings, and that happens so many times with the dilemma of Parkinson's disease, with the challenges and the busyness and the whole dilemma of living every day with a disease. You don't even know what you're feeling. But the thing is too, when you're really communicating with someone, you're talking about feelings, all right? So show me frustration, show me fear, show me upset, show me loneliness. Can you show it to me? It's an elusive thing that you have to define to me. So it's not easy to communicate a feeling from one person to the other. Am I right? Are you with me so far?
Yes.
So if I say to you, I am angry, what did I tell you? Nothing. I can walk around here and say, I am so mad my head is going to spin. What did I tell you? Nothing. I have to talk to you about how that anger makes me feel.
And why?
And why. Exactly. And why. So lots of times, what are some of the feelings that my patients and my caregivers are dealing with that sometimes needs to be communicated? And I will tell you, it is critical that you communicate, because a lot of the feelings, a lot of the challenges relating to Parkinson's disease are what? Negative. Is this happy? I am so happy to have Parkinson's disease, and the days are so easy, and I just have the best darn time, getting my sweetheart dressed every day, and doing everything that I shouldn't be doing. Is this a happy, positive, automatically branding with Parkinson's disease? There's nothing pretty, there's nothing positive about Parkinson's disease, and I'm the first one to confirm that. It's been my specialty for 20 years, all right? It can be very positive. It can be like a wonderful, positive, beautiful influence on lives and on relationships if you can find your way through it. But most of the things that you're talking about are negative. Like what? Frustration, number one answer. You're stuck with something you don't want. There's not one single thing we can do about it. Am I right? So a neurologist says to you, it's a positive diagnosis. You have Parkinson's disease. Can you look at them and say, I don't want to take it back? Or I don't think so. I don't have time for this. You know, I'm a busy person. I'm not giving up golf and tennis and cleaning the garage and all the stuff I love to do. You are stuck with something you don't want, and there is nothing you can do about it. You are stuck with the side effects, physical, emotional, mental, and social impact of this disease, and there's nothing you can do about that either. Is that negative? Is that frustration? You better believe it. How do you get yourself out of that frustration? You go back to my little one-liner. You cannot control what happens to you, but the only thing you control is what? How you react, how you respond to it. So your ability to say, I have it, I am still the same terrific person I ever was, I am bigger and better than my disease, and I will handle this. I will. Not I think I can. I will do what I can for myself. I will get my resources. I will work with my caregivers, and I will have quality of life. You with me?
Yeah.
Okay. What else are you feeling? Now the reason that I'm telling you I want you to communicate to get it up and out is all of these negative feelings, frustration, what else have you got going on inside your head some days? Fear. If you tell me that you don't have some fear factors with this disease, mainly fear of the unknown, then you're not being honest with yourself and you're not being honest with me, right? Because you have a fear of the unknown, and it's really enhanced with this disease because so many times we don't have a clue what's coming. This is not a disease that you can stage or that you can say, well, you've had it this long, so the odds are we're going to be looking at this. There are some diseases out there that will give you pretty much a definitive timeline, but not this one. This is all up to you and your body and your mind, okay? So don't worry about fear of the unknown, and don't dwell on fear, okay? And I do that by just living in the moment, living in the day, and coping with and accepting and tolerating the here and now, today, the reality of this minute. It's a lifesaver. It is for me. You know, this what if, perhaps, and what if, perhaps, and maybe. You know what I'm saying? What if next year I'm in a wheelchair? Perhaps I'll have to stop driving. Maybe I won't be able to hit a bucket of balls. What good is that? What if, perhaps, maybe? The key is, what am I doing today? What am I able to do today? Let tomorrow take care of itself. Got it? And realize all you have to do today, I always say, no one ever has to live up to anybody else's expectations. Your only responsibility is to be the best that you can be. Got it? Lower the bar. You know, if you can't get over it, shinny under it. Like the little go around it. Sidestep and step over. But fear is real. Don't be overcome with fear. Don't be afraid. That's why we have groups here. That's why we have friendships here. That's why we have resources, you know. Don't be afraid. You're all right. What else? Huh?
Sadness.
Sadness. Sad. 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 Heartbreak. Heartbreak. I'm a huge champion for caregivers. I'm a huge advocate. Have been my entire career for caregivers. You know, the heartbreak, and I mean ache, I mean physical ache, of seeing someone that you love and cherish struggling. with this disease. With this disease that is not getting better, it's progressing, right? We want it to be better. We want to fix it. We want to make it easier. We want to make it right, and you can't. And when you love someone and you see them struggling and frustrated and fearful and all the emotions that go along with it, it hurts. You are sad. And the other thing too is you are gaining with loss. You're sad when you lose something, aren't you? And we don't like to lose anything. I know I don't. Don't you take my Oreo cookies from me. We want it. It's ours. We want to keep it. We want to keep our independence. We want to keep our appearance. We want to keep the ability to do the things we want to do. We want to keep our mental acuity. Right? And sometimes this is a disease of loss. And when you lose, you're sad. Right? It's more of a grief. It's a grief. It's not a depression. You have the right to be sad. But you don't have the right to make it a lifestyle. I say to people in all walks of life, no matter what you're dealing with. And I'm here to tell you, everybody's dealing with something. Don't think that you're just the exclusive little group in here that's living with a huge challenge. I have yet to meet anybody get through their entire life with nothing. Am I right? Yes. All right. We all have things that we need to face. And the other thing too with Parkinson's is you're living with the challenges of Parkinson's disease, but life goes on anyway. Are you hearing me? You still have the concerns about the finances. You still have the concerns about other areas of health for you or your family members. You still have concerns with the children, the grandchildren. Right? The international climate. All right? So we all have something. You will realize with any challenge in life, I have found, and I've had many serious challenges in my life, that it really makes you realize what you're really made of. And I have never seen it to fail. I'm a firm believer that everything that a human being needs to meet and greet any challenge in life is inside of them. That shut you up, didn't it? It's always hiding out in your toes, but you've got to pull it up and use it. You have got what it takes to have a wonderful life. All right? Now, the need to get all of these negative feelings out, and the list goes on and on and on and on. Loneliness. Anybody feel loneliness? Caregivers many times feel very lonely. Why? He's sitting right next to you. Amazes me, every conference I do, you're together 24/7. I always say, how do you miss them if you're with them 24/7? Right? But they'll come in here and refuse to have so much as one seat between the two. I need to sit next to him, Marilyn, right next to him. And I'm like, why? You can see him, right? Okay? What makes you feel lonely? The isolation. With Parkinson's disease, sometimes, well, always it affects the social part of your life. In what way? It cuts it way down. Why? A couple different reasons. How's your social life? Getting out and about? Doing as much with your friends, with your family? Why not? Physical limitations. You know, you can wake up in the morning with a mind full of great intentions, right? I do it all the time. And by noon, I'm fizzling because I did too much the weekend, right? All right? Physical limitations. You have to be very tolerant about the fact that you can get up feeling great with the motivation, the empowerment, the plan for the day, and your Parkinson body might decide to have an off day. You ever had it happen? You got an off day. So you say, well, we're going to have to just rearrange our agenda for today. And it's tough, isn't it? Because I'm sitting up here saying to you, stay motivated, stay active, have a game plan, be with your friends, do interpersonal stuff, stay engaged. Get out of the house. But if you're having a day, you know, that you are really pooped out, that's your body telling you that you need to rest. Now, there's a difference between needing what I call a mental health day, physically and mentally. You just need the zone. You can do it a day. I'll give you 2 days, and then I want you out that door. Do not make it a lifestyle. Because the more isolated you become, the more lack of engagement with your life and your family and your friends, the harder it's going to be to get out the door. And isolation is very, very big for seniors and for Parkinson patients. Right? But your body will speak to you. This is the other thing I learned after so many years in nursing. Your body speaks to you as clearly as I'm speaking to you. And you need to listen to it. And the big problem why people get sick and why people die is because their body is talking, sending up all these warning signs, but you are smarter than anybody else, and you choose not to do anything about it. Right? Oh, this chest pain, it'll go away. You know? Right? Or funny feeling in my chest, oh, I overdid it, too much caffeine, da da da. Don't. You need to listen to your body. And when your body says, I am tired, I need to rest, then rest. You with me? And caregivers, you know, and there's a fine line here, because apathy, lack of activity is very common with Parkinson's disease. So you caregivers that are spending your life motivating and encouraging and rah, 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 sis, boom, bah. You know, you can do it, babe, let's go, the sun is shining. There's a sale at Dillard's, you need to take me, right? There's a fine line between realizing they're too tired to do it and accept it, and don't make them feel any worse. Because I'm here to tell you, my caregivers, when their body doesn't want to function, it doesn't want to function, and it's not their fault. You with me there?
Yeah.
But when you think that they're just goofing off and getting lazy, then you do, okay, let's give it a shot, let's get dressed. The encouragement, the motivation.
You answered my question, thank you.
What? If I keep talking and nonstop, I usually hit them all during the course. I don't know what I'm talking about, but what was your question, Thelma?
Wonder why you get so tired by the end of the day. Excuse me, after doing everything. I mean, by the end of the day, you're just exhausted.
You are exhausted. This is an exhausting disease for the patient and for the caregiver. And age. Oh, that's what I hate them. Better with age. I was trying to think about this program I used to teach for Memorial. It was called Better with Age. You know, like fine wine. That would be us, all right? Better with age. It's the aging process. It's the need to do so much. It's the patient having to work so hard they get tired. It's the role reversals, right? The role reversals, the added responsibilities. You know, we're finding that we're needing to do things that our partner was always doing. And sometimes, God bless them, they can't do it anymore, so you inherit that. So you caregivers, you're going to be tired. What's the rule? What is the number one priority? You better get it right. Yeah. Take care of yourself first. And you are going to get tired, and therefore you need to pace, and you have to do the whole wellness package that we talk about all the time. The eating, the sleeping, the stress management, the staying engaged with what you want to do, the asking for help, the don't do it if somebody else can do it. If somebody else can do light housekeeping, can run the Publix, can do this, let them do it, and focus on yourself first, and picking up the assistance for your loved one that they need, because you don't want them, you want to be a willful, happy caregiver. That's the name of my book. I'm resurrecting it. I'm bringing it back. It's called The Happy Caregiver. Is there such a thing? There is. Yes, you better be happy. How many of you are happy? I'm pushing it now, aren't I?
After
You
a
better
spa
be happy.
day.
Huh?
After a spa day.
After a spa day. Yeah, I'm planning to have one. I mean, just life at large, and I think that comes back, life at large. The good Lord wants you to be happy. He doesn't want you to go through this day sad and discouraged and depressed and what I call lower than a snake's belly emotionally. No, He wants you standing up and facing the day and having the positive attitude and the resources and the motivation, to stand up and face. This is a disease, just like anything else in life. You don't face challenges in life when you're on your emotional knees, do you? How do you face life? Standing up. And I say standing up, if only in your mind. We stand in our mind. I can do it. I am motivated. I am positive. I will try. Some Parkinson patients will never stand independently or walk independently again. Does that mean they cannot stand up to Parkinson's disease? No. I've seen extraordinary people all along my adventure with my patients and my families. The empowerment, okay? All right.
Could you go into the swallowing?
Sure.
And the coughing?
Sure, the swallowing and the coughing. To close down a little bit with the communication, if you continue to suppress both my patients and my caregivers, all these negative feelings, I'm so mad at him. I am so mad at him. I am so sick of doing what I'm doing every day. I'm getting discouraged. I'm getting depressed. I'm angry. I'm lonely. I'm isolated. What happens when you pack all these negative emotions down? And then they're pressed in here, and you can feel them in here. You know when you're revving up. You know when you're getting that. And then somebody says the slightest thing. And what happens? You explode like a shaken bottle of Coca-Cola. You drop it. You take off the cap and it shoots all over the ceiling. That explosion is the worst thing for you, and it is the worst awful thing that can happen to your loved one. Please listen to me. This is why I put so much power in communication. Get it out a little bit at a time. I don't want you to complain to me every day. Come to me at 10 o'clock and say, I'm depressed, Marilyn. And then you come back to me at 2 o'clock and say, I'm furious, Marilyn. Okay, that's not what I'm talking about. I'm talking about when you have something surface in your heart and in your mind that's got you a little bit unsettled, then you find a time and you go to your loved one and you talk about it. Or you go to someone in your life that you can trust with your feelings. Now, I got to tell you, there's a lot of people in all of our lives that could give a flip about how you're doing. They say, how you doing? They don't care. It's lip service. It's just we run around saying, hi, how are you? Please don't tell me, because I don't have time to listen, Jean, and I really don't care. Right? It's a common courtesy. How you doing? So you want to go to somebody that you can trust with your feelings. Somebody that loves you, understands you, and someone whose opinion matters to you and that you will heed. You with me with that part? So it's twofold. Get the feelings up and out, but give it to somebody that you admire, respect, and if they say, I think that you should do this, it's in your best interest. Even if you don't agree, you take heed and you listen. You hear me? Otherwise, just talk to the mannequin in my office. All right? So that's the twofold. Get it up a little bit at a time so you don't explode. Because you caregivers, I want you here. I want you in a state of peace and balance. I want you managing your stress. I want you sleeping. I want your ability to stay positive. I want you to be able to have enough positivity for yourself and enough to share to your loved ones, right? The other thing too is when you explode verbally, it usually is not a nice thing, right? I know with me it isn't. My kids know when I start revving, head for the next county. Right? It's usually not a happy conversation. It's not respectful. It's not dignified. You cannot communicate unless you are talking softly, dignified, eye contact, interactive. You with me? So when you explode, your caregiver, your Parkinson patient is feeling bad enough, in case you haven't noticed. Get behind their eyes, walk 1 hour in their shoes. 1 hour in their shoes. They're living with the toughest disease out there. All right? Your goal is to have a positive influence on their life. And if you holler at them and you yell at them, all right, you're hurting them. And you know what? With communication, you can't unring the bell. So if you feel it coming up from your toes, please excuse me for a minute. Walk away, go out the front door, get out of there, you understand me? But if you can't contain it, what do? You sit down quietly and say, you know what, I am so sorry, I'm at wit's ends. I should have talked to you about it, I should have come to you for help. Go to your loved one for help, for support. A lot of times people think, caregivers think, well, he has Parkinson's, I don't want to put anything more on him or her. It's still your loved one, it's still your partner, no one knows you better than me. They're still in there. So if you feel yourself frustrated, getting angry, getting upset, getting afraid, you go to your loved one and say, you know, I want to talk to you about this. You know, I am really starting to feel overburdened, you know, about our lifestyle, and I think we need to make a change. What can you do to help me? What changes do we need to make? That's why I'm so proud of you. Went together as a team. This is a group partnership. What is in the best interest of the patient and the caregiver? And if you need to make a change, you talk about it and you do it. You can't manage that big house with all that stuff, then you find beautiful alternative living or a smaller apartment. If you're getting burnt out, you pick up the phone or you call me or you call one of the resources I've given you. You bring in somebody else to help you out, all right? But keep the dignified, loving communication going on. If your loved one has some level of dementia, cognitive impairment, talk to them anyway. Keep talking when no one wants to listen. I do it all the time. Because what? It's still out of you. And even though your loved one that might be dealing with memory loss and dementia, like Pam talked about on Friday, they're hearing it, it's going in. The thing is, it might not be coming out in the perfect sentences or the perfect thought process. But at least you're sensing you're getting it out and you're sharing it with them and you're having the camaraderie with your loved one. Don't stop talking, okay? Pick a time to talk. You know, if his favorite football game is on, don't go running in here. Guess what? You know, it's the commercial. I got something to talk about, and it's critical. I don't want that. You know, or she's heading to Publix. Say, wait a second. It's urgent. Pick a time. Start in the morning and say, you know what? I have something, my heart and my mind, and I want to share it with you. I need your help. I need your advice. I need to get this off my chest. I need you. A lot of times Parkinson patients don't feel they're needed like they were pre-Parkinson's. They are needed. It's the same extraordinary person. Am I right? Am I right?
Yeah.
Yes. Thank you. Okay. Any questions about speech? We have the classes here, Mary Spermelli. And the other thing too is speech is going to be altered with Parkinson's disease. The minute that you start a diagnosis with Parkinson's, just because you're talking perfect, you need to be in Mary Spermelli's voice aerobics. You understand me? Or you need her DVD and do it at home, because to keep them strong, to keep your voice strong, the muscles strong, and the breathing, all this in here is affected. You know, you're leaning over, you're not feeling your diaphragm, you don't have the lung volume, you don't have the muscle volume. Okay. Mary Spermelli is a huge resource. Sing with the chorus. Sing at home. Do exercises at home. Ho, whatever, when you're making tuna fish. I don't know. Make noise. All right? And keep it up here. All I give you every excuse. I give you every permission to yell. Okay, so if you're hearing on there, just scream, hi Marilyn, okay? But really work on that. And my caregivers, don't constantly, I can't hear you, speak up, speak up, speak up, speak up. If they could speak up, they would speak up. If they could sit up straight, they would sit up straight. It drives me crazy when I hear a caregiver, sit up, sit up, sit up. Stand up straight, sit up. And I'm like, honey, gosh. If he or she could, they would. You know, so just a simple thing like trying to straighten them up a little, pushing them up a little bit, or this little bit of courtesy. Courtesy, I made up a new word. Courtesy, respect, one for the other, maintaining esteem. It's not what you do, it's how you do it. All right, that's speech and communication. Now we're going to move on to swallowing. What is the number one dangerous risk of Parkinson's disease? The number one acute risk with Parkinson's disease? Huh? Falling is right up there, way up there. You die from falls. Falls are the number one killer of seniors, above heart disease, cancer, stroke, everything. Falls. Number one killers of seniors, which now I'm calling a senior. I've got it moved up to 69 now. Senior. Aspiration. Aspiration, all right? Swallowing becomes difficult with a Parkinson patient. Why? Muscles. What's the tongue? The jaw, you know, and then you get it back here, and then it slides. You got to get it there, okay? Now when it goes down, you got two pipes. And if you're swallowing correctly, it's going to go where? You know? It's going to go into your stomach, where it belongs, where it can be digested, and where, you know, it can move through the system and give you your nutrients. If it doesn't go into the stomach, it goes where? It goes into the lungs. Is the lung a sterile cavity? The lung is a sterile cavity. Is food sterile? Okay. So what happens? You introduce a dirty, non-sterile whatever into the lung, all right? And it breeds for aspiration pneumonia infection, all right? Now realize that you can be dumping into your lung without choking. Everybody thinks, if I'm not choking, I'm swallowing just fine. You can be swallowing improperly without choking. So if you're noting, my patient, this is one time you got to open your mouth, and this is one time you have to be very proactive with your neurologist. They'll either send you to a gastroenterologist for a swallowing study. How many of you have had them? Yeah, really pay attention to this, and I mean it, all right? If you're a Parkinson patient saying there's something going on here, I'm not feeling right, or I don't feel it's going down right, or whatever, you must tell your caregiver, you must call your neurologist, you must get that consult. It's critical. It's critical because once you get into that level of infection, then you look at pneumonia. Pneumonia is a killer for us, isn't it? Okay? So what do we do to avoid choking? Now you've got to understand that the ability to swallow for many becomes difficult. It's why it's difficult for them to speak at the same time. You know? I talk to you for an hour, and right in here never stops for an hour. Right?
Yes.
But with chewing and with swallowing, it's the same muscles, all right? So what do we do to prevent choking? And choking is very serious as well. Very, very serious. All right? How many of you have ever choked? You know, it goes, you say, oh, it's going down the wrong pipe. It's scary, isn't it?
Yes.
It's very, very, very scary. And you see somebody color, you know, turn the color of one's shirt is not a good thing. All right, so how do we prevent choking with Parkinson's disease? Now, I want you to pay attention to this. Huh? Eat slowly.
Take smaller bites.
Take smaller bites.
Chin on the chest.
Chin on the chest to swallow, yeah. Did you know that? Everybody thinks that it's easier to get a pill and food down this way. You want to flex. So if you're having trouble with your pills or whatever, you want to flex, and it'll have more of an open track this way. All right. 1/3 of the digestion takes place where? Take a guess.
Stomach.
Take another guess.
Mouth?
In your mouth. Hello. Did I teach you something new?
Yeah.
So the big thing is chew. Chew. So many people like, you ever see them, they're going like this? I don't think you're chewing anything. And it only takes 3 to 5 seconds to hit your stomach. Did you know that?
No.
You didn't? Yeah, because your stomach is not down here, it's up here. When you have heartburn, you know, it's dumping right here. It's higher than you think. This is a colon down here, all right? So chew your food. Select your food that you know is safe for you. If you're having difficulty chewing, am I going to serve you a grilled steak and corn on the cob? Huh? And nuts? Hot dogs, don't eat a hot dog. You ever seen them make the hot dogs on television? All right, so choose your foods wisely. Chew your food, sit down to eat, no eating on the run, no eating standing up, no eating in the car. Sit down, pay attention, focus on the pleasure of the eating experience. Oh, I never said that before either. Pay attention. It's time to eat. I'm going to pay attention. I'm going to take small bites. I'm going to chew. I'm going to check that sandwich. I have no idea. I see those sandwiches come in. Lots of times I'll say, what's in it? You know, I had to say last Friday, I can't give my patients apples. Right? And I wasn't going to stand and slice them up for you, because then they turn brown and everything. No, I wasn't going to do it anyway, okay? But I had to make the judgment call. I do not give Parkinson patients in a group setting apples. All right? Eat apples. So I don't want you choking. I can't control what's introduced into your mouth. I can't control what's on the outside of it. So choose. If you can't eat an apple, you can eat applesauce. You can eat stewed apples, right? You can eat apple crisp. So pay attention to your food choices. Avoid foods that you can't handle. Utilize what? Gravies and sauces. All right. Small portions. Don't overload the spoon or the fork. All right. Feed yourself. I don't care if the peas are rolling off the dining room table. Get you a nice tablespoon and enjoy the peas. Got it? Feed yourself for as long as you can. All right. Finger foods. Serve foods that are easily managed. French fries. I love French fries. Baked potatoes. Nice things. All right. But really pay attention to this. All right. Be careful as well with your consumption of beverages. There's pros and cons to the straws. A lot of folks, they find it a lot easier to swallow with, the flex straw. They're very nice. All right, but you have to be careful, because straws, you can suck too much volume in, and when you throw it to the back and then it dumps, you can cough then. Does that make sense to you? So if you want to use the straw for convenience, if it's better for you, little tiny sips. Did that help you? What are some good food choices? I mean, even things like, dry cereal can be choking. So, let it sop up with the milk, or try oatmeal and stuff like that. Some toast, if you grill it too hard, toast it too hard. I left an English muffin in the toaster when I was preparing food for my family. You should have seen the thing. It was like a Frisbee. It was actually, I would have choked on it. So just common sense stuff, all right? Puddings, things that you know, and don't put yourself at risk. Realize how important that you are. you know? And you have to do prevention intervention. You have to reduce your risk of everything. Choking and falls and depression and lack of mobility and all this stuff. You're running interference with this disease, right? All right. Focus on well-balanced meals. Eat. How many of you are eating breakfast? How many of you are eating breakfast? And this stuff over here on the plate doesn't count, I don't think. I gotta do better than that. But you know what? You all love the sweets. I was feeling guilty, you know, when I was giving you sweets and everything, and I did a survey. Because what you do at home is your own business. But, you know, I don't think a piece of Danish is going to hurt anybody, do you? So I did a survey because I thought, well, should I take away the bagel or the croissants? You know, the bagel is no fat, the croissant. I did a survey and I said, oh, she loves her sweet when she comes to Parkinson Place, and so I'm not taking it away from you. All right? That little cake in the morning or the chips here, I'm going to keep giving to you. But generally, eat 4 to 6 smaller meals a day. You're taking a lot of medications, am I right? Your tummy does a lot better when you got a little something in there. All right, applesauce, pudding, toast, crackers, or whatever. Sometimes you do have some loss of appetite, a little bit of nausea with some of the medications. These are chemicals, all right? They're going to upset your stomach. So make sure that you have good, healthy choices, fresh fruits, fresh vegetables, low-fat dairy, low-fat, all right? Eat the best meals that you can so that you don't become malnourished. Drink, you heard what Bonnie said. How much? Half your body weight in ounces. You got to do the math, you know, with your water, with your hydration. You know, once you consume these drugs and it's done its purpose, you want to flush them through the urinary tract and get them out of you. Okay. Any questions about speech and swallowing? I want you to start today really having nice conversations. Yeah.
Didn't we talk about stretching muscles and stuff when we were talking about speech?
Yeah.
You know,
Yeah.
I went in and sing. You know.
The Loud is a wonderful program. I've been searching for, and Toya and I are working together for a certified Loud speech pathologist. I would love to have that in there because Mary Spinelli is certified in Loud, but she's gone forward with her career and she doesn't want to treat that many hours a day. She wants to do her customized treatment plans for home, and she does a lot of teaching and conference and everything. But the Loud program is great. I'm going to try and get it in here for you. Okay. Any other questions about anything? Okay. What are the nice things that we can say when we communicate? It's my favorite.
Thank you.
Thank you. Please and thank you goes a mile, right? I'm sorry. What's my favorite?
I love you.
I love you. Okay.